Senator John McCain of Arizona leaving the Senate chamber early Friday after casting the vote that ensured the measure's defeat. Gabriella Demchik for the New York Times, Washington. The Senate on Friday rejected a new, scaled-down Republican plan to repeal parts of the Affordable Care Act, seemingly derailing the Republicans' 7-year campaign to dismantle the health care law. Senator John McCain, Republican of Arizona, cast the decisive vote to defeat the proposal, joining two other Republicans, Susan Collins of Maine and Lisa Murkowski of Alaska, in opposing it. The 49-51 vote was a huge setback for the Majority Leader, Mitch McConnell of Kentucky, who has spent the last 3 months trying to devise a repeal bill that could win support from members of his caucus. The truncated Republican plan was far less than what Republicans once envisioned. Republican leaders, unable to overcome complaints from both moderate and conservative members of their caucus, said the skeletal plan was just a vehicle to permit negotiations with the House, which passed a much more ambitious repeal bill in early May. The so-called skinny repeal bill, as it became known at the Capitol this week, would still have broad effects on health care. The bill would increase the number of people who are uninsured by 15 million next year compared with current law, according to the nonpartisan Congressional Budget Office. Premiums for people buying insurance on their own would increase by roughly 20%, the Budget Office said. Vice President Mike Pence arriving at the Capitol late Thursday. He was not able to save the measure with a tie-breaking vote. Zach Gibson, Getty Images. The new, 8-page Senate bill, called the Health Care Freedom Act, was unveiled just hours before the vote. It would end the requirement that most people have health coverage, known as the individual mandate, but it would not put in place other incentives for people to obtain coverage, a situation that insurers say would leave them with a pool of sicker, costlier customers. It would also end the requirement that large employers offer coverage to their workers. The skinny repeal would delay a tax on medical devices. It would also cut off federal funds for Planned Parenthood for 1 year and increase federal grants to community health centers. And it would increase the limit on contributions to tax-favored health savings accounts. In addition, the bill